this postural assessment. I'm loving her house and wanting to go to wherever this, I think she said she lives in Florida. We want to make sure we've got good lighting. And the reality is that if we get somebody in the full screen, they're so far away that we lose a lot of details. So oftentimes what I'll do is I'll do upper body, lower body. It works out just fine. We just have to kind of reset every time. So Tracy, whenever you're ready, want to make sure you don't have any shoes or socks on. One, we want to be able to see the feet. And two, if there are orthotics or anything else in there, we don't want somebody's posture to be corrected. The idea is that the client stands as naturally as possible so we can see the real deal. Okay, and then one last question. I was going to say, can we move that chair out of the way a bit? Although I do like it very much. All right, perfect.
Okay.
Perfect. So I'm going to explain this to you just like anybody else. Okay, we're going to have you face the camera straight on, which right there, you're perfect. You know, we don't want somebody turned slightly, and you can usually tell by a number of things. You see more of one ear or more of one shoulder. So right now we've got her squared away. So listen to me first, and then because I'm talking to you just like a client.
Okay.
We're going to have you march in place just a few times with your eyes closed. Now, do you have any balance issues? Do you have any neuropathy?
Documented? No, but I'm not a balanced person. But
We're not talking emotionally. Now, all right. So the reason I'm asking is, again, just pretending you're anybody. We want to make sure that our client does not fall over while we're doing this postural assessment. So if you said, yeah, I can barely stand up straight, one, I might have you pull one of those stools over. So if you needed something to lean on. Two, I wouldn't have you close your eyes, you know, so on and so forth. We don't want to put somebody in harm's way. So when we start this, right how you're looking at me right now is how I want you to stay as just straight ahead. Once you're in position, you want to try not to move. If you do, I just have you reset by marching in place again. So don't try and stand erect. Don't try and stand like a soldier. Just be how you are. So go ahead whenever you're ready. Close your eyes. Just a couple marches. And then you can just plant your feet and stop. Now, the one thing, and you guys, if you notice, and Tracy, for you, you're going to have to just, you may end up having to watch this later to get the full whatever, but when you did that, you moved your body. So I think that your computer, is there any way to lift it up a bit, like put some books under it or anything?
Sure.
Because I'm noticing you looking down, which is going to change the results also. Where in Florida are you again?
Port St. Lucie. It's on the East Coast, about 40 minutes north of West Palm Beach.
Oh, nice. Nice. Okay. Yeah, perfect. So let's just do that again. Quick couple marches. And then you can just plant your feet, open your eyes, but don't move. All right. Perfect. So what we're going to do now, there's not too many people on today and everybody's kind of in the background. So I'm probably going to be doing this myself. And I don't want you to do this, Tracy, because then that's going to screw everything up. So like I said, we'll just roll with it. So I start off at the ears and I'm looking to see if they're level. Now, the great thing is you can literally take your pen, your ruler, your straight edge right up to the computer and go, okay, I see that one side is elevated or they're level, whatever. It appears to me that your earlobes are level. Now, I do see more of your left ear, a lot more than your right, which could very well be just, again, the angle of where your computer is. We'll see it more when we do some dynamic movement as opposed to a static test, which is what we're doing right now. So the next thing I do is I kind of make a plumb line right down the middle of the body. going, from the nose all the way down to the toes, which of course we can't see right now. And we're looking for symmetry. Now, none of us are perfectly symmetrical, so don't expect that. But if you draw your eyes to the left shoulder, you can see that either the left shoulder is elevated or the right shoulder is depressed. Now, we know we've had radiation and surgery to the right side. So my guess is that the right side is, well, actually, it could be two things. It could be that there's a little more atrophy, and therefore you've overcompensated on the left side, through all these processes. Now, this is all speculation, but that's what it is. It's like this process. We're Sherlock Holmes, and we're sitting here with the magnifying glass trying to solve this problem. We don't know the answers yet. We're just starting to formulate this. So I am going to say that the right shoulder is depressed, and I can also see that your fingertips are lower on your right side than your left, which makes sense. In module 4, you guys, in Teachable, after module 4, you're going to see a section called Forms. And in there's actually an assessment sheet. There's all these introductory letters to the doctors, health history questionnaire, liability, all that. But I'm just writing on just a piece of paper because I'm too lazy to print them off. But they are there for you, and it makes it really easy because you just kind of fill in the blanks. All right. So not only do I see more of your left ear, I see more of your left arm, your left elbow crease. So you may have a hip rotation, which I'm not ruling out. Or again, you may just be standing a little bit askew. So don't worry, don't try and correct it because we don't know what the answer is. Now both of your palms are facing your body, which is great, because what happens when somebody has really severe upper cross syndrome or rounded shoulders, we go from this to this. I'm exaggerating a lot, but sometimes you see these like big bodybuilders walking around like that. You've got tightness here and not enough strength back there to balance it out. And then sometimes with bodybuilders, it's the girth also. But for most people, if you see their arms hanging and you see the back of their hands, that means their shoulders are extremely protracted. So that's a good sign that you don't have that, Tracy, because that's one less thing to correct. All right, the next thing, I don't know why I rolled my chair in because I'm probably gonna have to get up again. I have to lead you. You may know how to do this, but I'm assuming you know nothing. So you have to explain this to your client in a way that they can help you conduct the assessment, because we're not there in person to palpate, to find specific landmarks. Where if I was there in real life, I would say, Tracy, are you okay with me poking around at your hips? Because I'm going to get up close and personal. So let me show you what we're doing first, and then we'll do it. Sorry about the old tattoo that I regret now, as most people do, right? So we find the iliac crest. And so if you think about it, it is your horseshoe right here.
Let me move the, because I don't know why you're not coming up when.
Oh, I know what it is. I know what it is. It's because I'm not spotlighted. You're spotlighted. Hold on. I forget that.
So is it better if I take this shirt off?
You can. Okay, so now you get to see my regrettable tattoo. All right, so
We all have some regret.
all right, so here's your iliac crest. It's like a horseshoe. Okay, you've got that on both sides. So what I want you to do is to find the top. You should be able to just dig in there and then try and put your fingers in horizontally like this, so that I can see if they're level. Now my left is elevated right now because I have a plantar fasciitis boot on my foot, which is lifting it up. But see, that would be level. Now it's elevated. So I'm gonna wait, Tracy, because I'm gonna let you
Nice
go.
abs.
Oh, thanks. And I don't do any abs. It's from
I've been
Snoop.
working out like crazy.
Yeah, I'm too lazy. But then the next thing is we find the anterior superior iliac spine. So that's right here. And now if this is somebody who is obese, they're not going to find it. Don't put them through this. Okay. So here's my ASIS, and then here's my PSIS. And I mean, literally I can knock on them because they're bony. So First, I'm gonna have you, and again, not yet. First, I'm gonna have you find your ASIS so we can see if your hips are rotated, because we're gonna look toward the midline. Does one appear closer than the other? Then the next thing, we'll do a side view. I'm gonna have you, once again, with the straight finger to the ASIS and a straight finger to the PSIS. And you can see, as far as I can tell without my glasses, that I'm fairly level, right? Where if somebody had an anterior pelvic tilt, this front finger would be lower. They had a posterior pelvic tilt, their back finger would be lower, or their hips are in neutral. So this tells us a lot about what's going on with the lower body. Let me re-spotlight you. Now that you've seen all my delightful tattoos. I try and tell I mean, like you said, we all have regrets, and I don't care that much because I can cover them up. But my daughter started getting these hideous tattoos on her arm and hand, and I'm just like, God, you're gonna regret this later. But what can you do, right?
Yeah.
All right, so you found it. Beautiful. All right, just use your index finger. Okay, that's fine too, if it doesn't hurt your hand. Okay, so you appear to me to be completely level from side to side. So I'm going to write down hips level. Now, would you see if you can find the anterior, I'm just going to call them bony. No, still from a front view, still from a front view. Use both fingers. Here, we may have to remove the spotlight again. Use both fingers right here.
Oh,
Okay. So I want to see if they are, if your hips are rotated or symmetrical. Okay, so it looks pretty even to me. Okay, now let's go ahead and have you turn sideways, and then we can do it again. So now the first thing, just before you do this, I can look at your skirt. No, you're good, you're good.
oh,
And it appears, I'm exaggerating, but it appears that the front hemline is slightly lower. So I'm going to guess there is a slight anterior tilt. But the fingers will tell us. So it's easiest if you take, if you take your right finger on the back and your left on the front, it'll be easier to see. And just dig on in there.
where are, let's see.
So here, let me let you look at me again. Okay.
Right, oh,
So-
okay, right here.
So the front one's a little more prominent. The back one, not as much, but you should be able to feel the bones in there. Okay. Okay, so now look, just keep your fingers where they are, but look forward so you're not looking at the camera for me. Look, there you go. Okay, so it's not even, it's so slight that it's normal. So there's really no noticeable pelvic tilt. You're in good shape. All right, the next thing we're going to do, Tracy, is go ahead and face the side like you just were, but we're going to reset. We're going to march in place, because now what we're going to look at is we're going to see, we're looking for forward head. Okay, so go ahead and take a couple steps, and don't try and adjust your head. Just be how you are. And then stop and don't move. All right, we've got a real good view here of the shoulder and the alignment of the ear. Now I want you to, don't look at the camera. Sorry, Tracy, I'll show you afterwards. The clavicle, here's the front of my, oh, you can't see me. The clavicle is like a coat hanger, and the earlobe should be lined up right in the center of the coat hanger. Now, her earlobe will come down. If I had a pen, it comes down right on the front of the clavicle. For every inch the head is forward is the weight of the entire head on the cervical spine. So what I see, Tracy, you can face the camera now.
Do you want this from the left side or the side where the surgery was?
No, it doesn't matter, because we're going to see
okay.
one thing in this particular thing. So would you say that you feel, and I can also see in your neck, like the, not vascularity, but the lines in your neck, which show that your muscles are straining. So your head is severely forward. Now,
Yes.
do you spend a lot of time reading or on the computer?
My chiropractor told me I have the tech neck.
Okay, there you have it. So if this is not corrected over time, potentially we see somebody like, the little old lady hunched over, and we don't
Right.
want that. This can totally be corrected. I'm going to be blunt, just like I am with my husband, because he has that too. I'm like, you're going to look like, Quasimodo. So the good news is this is entirely correctable, not with chiropractic, not with massage, not with exercise alone, all of the above. The chiropractor can realign you, but you have to work the muscles to
Right.
strengthen to keep you in that position. And that's the problem with people who just do one thing or the other. You have to have a balance to keep things healthy.
I was in bad shape, like in July of 2021. Cause I was all like this and back was
Absolutely.
killing me.
Absolutely.
Chiropractor actually, pushed me back.
Yes, yes. And I mean, it's very likely that, you can have scar tissue and what's the word I'm looking for? Scar tissue adhesions from
Right.
the radiation, although you had minimal surgery. So guys, she had a right segmental mastectomy and 3 lymph nodes removed on the right side. So she does have the risk factor for lymphedema, having the lymph nodes removed, but she also had radiation. So, you didn't have a full axillary lymph node dissection and you didn't have just one lymph node removed. But, for all intents and purposes, the risk is probably around 30%. Then you also told me you gained 15 pounds. Now you look really good, actually. So you've
Thanks.
been very lean, but nonetheless, that extra body fat can increase the risk for lymphedema.
I used to be 15 pounds lighter and I kind of liked that.
Yeah, and
No,
but
I'm just,
I'm just
taking
letting
a
you
lot
know
of weight.
you look pretty good. So
Thank you.
she also had she has a vertical abdominal incision, much like the retropubic prostatectomy. So surprisingly, and we'll see this more from
Wanna
the
see it.
side. Okay, so oftentimes when somebody has an incision like that, like we talked about with the prostatectomy, they are leaning forward. And so we'll see, because that could also be part of the neck thing.
That
And
was
then,
so many years ago, though.
yeah, and you've probably corrected it, but not everybody does, if they don't exercise. And then she also is menopausal because she has no ovaries. So these are all things we'll go through later when we actually do the case study and we break each of these elements down. So the next thing we're going to do, we're going to have you turn 180 degrees. So we're looking at your back. Okay. And then let's do the same exact thing. Don't try and stand up straight. Be however you are. Take a couple marches in place and then just plant your feet and don't move. Okay, perfect. So now we have the back view. We see a little bit more of the right ear. We see, again, noticeably the left shoulder's elevated, the right shoulder's depressed. We can see the back of her elbow, and you can see that the right side is lower than the left. Also going down to the hands, same thing. We do see, being that we're seeing more of the right side, I'm going to speculate at this point there might be a little bit of medial rotation on the left side, which is bringing everything inward. But I don't think it's noteworthy, so to speak. The next thing we do is we go down to her shoulder blades, which is pretty much impossible to tell anything. We're looking for winged scapula, which is very difficult to see virtually unless it's really bad. But you would see the shoulder blade protruding on one side or the other. And this can happen after an axillary lymph node dissection, which is not what she had, where there is damage to the long thoracic nerve that causes a temporary ceasefire of the serratus anterior, and that causes the shoulder destabilization. So that's about everything that we can see right now. I will ask you one question. Have you ever been diagnosed? Yeah, you can turn back around. Have you ever been diagnosed with scoliosis?
Yes.
Okay. What is your curve?
I don't know. Can you see it?
Okay. Actually, that's wonderful that you just did that, because now we can see your shoulder blades. So guys, do you see, well, nobody's going to answer me, but the right shoulder blade is definitely more pronounced. So I'm going to put right winged scap. And yeah, it's pretty slight. So if you guys draw your eyes toward her right shoulder blade, you also see this right vertical line next to her spine. And I'm going to assume that that's where that curvature is. It's slight, but there. Yeah.
Also, you can see like down here, how the fat, well, here we go. I'm not a very modest person, as you can tell.
It's all right. It's all right. Don't turn around though, because that I don't know if we're allowed to do that.
Right.
Yeah, so I see the curve, right? I see it in your thoracic. I don't see it down there.
But I mean, just how this fat.
Oh, yeah.
Different.
Now explain what you were saying about the pockets under your armpits with the lymphedema.
So, like right here, if you look here and you look here, it's different.
And they did or did not diagnose you with lymphedema?
The people that I'm going to right now are just so perplexed because I'm not swollen and puffy
Yeah.
like this.
But just
This
kind of loose.
area right
Yeah.
here.
Okay.
When I went kayaking because nobody told me, you know, I just heard don't do any.
If you want, you can pull your shirt back up and turn around and talk to us.
Right.
I feel,
But
like,
so that area right here, there's some reason this skin is, I don't know why it's extra and full, and sometimes it's full more than others. But
well,
one
I'm gonna
time it was like
guess you.
Huh?
Yeah, I'm gonna guess you have atrophy. So I think that you have atrophy and you've gained weight. And depending on where an individual stores fat, you know, that might be where you do. So I think that as you start, the next thing I'll ask you between today and Thursday or whatever, if you can send me any exercise routine that you do. If it's nothing, it's nothing. But if it's I walk 5 times a week, I ride the bike, I do Pilates, I do yoga, I do weight training, whatever, give me details, because then we can use that toward our final destination.
Excellent.
Okay. All right. Now we're going to need to readjust the camera. So we're down. I need to see your knees and your feet. And if possible, to make it as level as you just had it. Perfect. Okay. So we do the same exact thing, front, side, back, marching in place. So whenever you're ready, and try not to position your feet, let them land where they land. Okay.
Okay.
All right. Whenever you're ready. Okay, perfect. So first, let's look at the knees. And we've
I'm
already.
not balanced.
What's that?
I said, do you see I'm not balanced?
No, not noticeably.
I was waving.
Okay. Well, you do a good job of covering it up. Okay, so we've already established that the right shoulder is depressed, the left shoulder is elevated. So it's interesting because when we come down to the lower body, we see they appear level. Now the left, I see you flexing your knees. The left knee has, I'm going to use this term for lack of a better one, more creases than the right, which can sometimes be indicative of one leg having more hypertrophy than the other. It could be that one leg is tighter than the other. So we don't know the whole picture yet. But the patella appear level. They also appear, well, actually, now that you're doing that, are you flexing your knees? Just try and relax.
I have a medial meniscus tear on my left.
Okay. Left medial meniscus. So that's probably what we're seeing. Okay. It's hard to say. I want to say that they look a little laterally rotated. However, we'll see it better when we do a little squat test. When I look at your feet, they're both going straight forward, so that's a good thing. It appears to me, and correct me if I'm wrong, does your left foot feel as if it's leaning, that the emphasis is more on your pinky toe or your big toe? Meaning, are you rolling in and pronated?
I would probably say my big toe.
That's what I see. So left foot pronation. And it looks to me the opposite on your right, but I could be wrong.
That
Do you-
is true, because I
Okay.
also had a bunionectomy on my right.
Okay. Okay, so I don't know if you guys can see this, but if you look at her ankle, it looks kind of like it's collapsing inward a little bit on the left side where that is not notable on the right. And it also seems like I don't know how to explain it, but it seems like there's just more emphasis on the little toe on the right side. So the next thing we're going to do is face either side again. So we've got a side profile, and then we'll do the marching in place once again. Just a couple little steps there. Perfect. Okay. And what I'm looking for, and it's a little bit hard because you see there you go. See the reflection of not the reflection, you can see part of the left leg behind the right. So you got to be able to differentiate. But what I'm looking for is to see if her legs are hyperextended. In other words, if there is no bend in the back of the leg, which she looks normal. When Tracy, when you relax and you're not fumbling for balance, you've got what appears to be a normal bend in the back of your leg. If your hamstrings are pulled out, meaning like there's no curve in the back of your knee, usually it's because you have tight quads. So lastly, let's have you face your kitchen again. Okay, and you're a little too turned. Take a step to the right. There you go. Nope, too much. Okay, perfect. Now go ahead and march in place again. Okay, perfect. All right, so now it's interesting because from the back, I can see when I look at your left Achilles tendon and I can see your foot collapsing inward, but it also looks that way on your right. So, it doesn't look like supination on the right side, but I'm going with what you're telling me. And everything looks pretty symmetrical from the back, in my opinion, if anybody else has anything to add to it. And for those of you who are watching the recording, which is going to be the majority of you, if you have any questions, obviously, reach out to me. All right, Tracy, next thing we're going to do is we're going to do a squat test so we can see you in action. Now, in this particular case, if we can get more of your body in, that's great. If not, we'll also have to do this in 2 steps. And as you guys are going through,
I don't know why it's upside down.
I don't know, but you're sideways. You look like you're sticking out the side of the wall.
I'm moving
this is all in module 3. No, that's not going to work. So let's just put your thing back to how it was, and then we'll
maybe this. Let's try this.
Just moving it away. Yeah.
I don't know if you'll be able to see us well, but
For the squat test, it's a little easier because we're not looking. Oh, perfect. Okay. So you're going to start with your arms overhead, palms facing each other. Okay. Straighten them as much as you can. All right. Beautiful. Stand in a squat position and continue to look straight at the camera. Now, we're going to do this slowly. What we're looking for, and this is in module 3, you can already see that the right arm goes out to the side a little bit, and that's probably from tightness. So we're looking to see if the arms go out to the side. We're looking to see if they fall forward. We're looking to see if she bends forward at the waist. We're looking to see if her knees collapse in or if they bow out. So that's why we want you to do this very slowly. Whenever you're ready, Tracy. Okay, you can see the instability at the knees a little bit. Come on up, just slowly, just keep moving. Just keep moving. Okay. Yeah, just keep doing squats unless it hurts you. Okay, definitely focusing in on the arms. And there's a little bit of a lean towards the left side. Okay, go ahead and relax for a minute. So the right arm goes to the side, and so does the left, but the right is more severe. All right. All right, now we're gonna do the same thing sideways. So now we'll really be able to see if the arms are falling forward, if you're bending at the waist. So same thing, start with your arms above your head, palms facing each other. Yeah, good thing the fan's not going. All right. Now what you're looking for, guys, is that her arms and her tibia, her shins should be parallel. And actually they are. It's pretty good form there, Tracy.
Thanks.
Okay, we do see the head wanting to go forward. One more, nice and slow. There's a little collapsing at the waist. Okay, go ahead and relax, but not bad. Then the last one we'll do is looking at the back of you, just giving us a different vantage point. So start with those arms straight up. Can you move a little bit more to the right because we've lost your left foot? There we go. Maybe take a step forward a bit. Nice. Okay. So now we can also look and see what's going on at her ankles. All right, whenever you're ready. You're definitely seeing those arms going out to the side, and the shift leaning kind of toward the left because it's like you're sticking your right tush out a little bit more. And you see that right foot, can really see the right foot collapsing inward. So I'm leaning away from the idea of supination. Okay, go ahead and relax. So after seeing, I'm going to take you off a spotlight here so we can all participate. You can sit down if you'd like and just relax, whatever, Tracy. After
One thing else I'll tell you.
uh-huh.
I started a class in March of 2021. Right after it was on health and human performance.
Okay.
And at that time, I could not do this.
Interesting. Okay.
I couldn't like stand like this. And so I've been practicing it for 2 years. See, I would do that all the time.
Yeah. So working on balance. Okay. So I'm going to say you have a slight balance challenge. It's not severe. So since we have some time, why don't you go ahead and tell us what is your exercise routine? It can be none, but what do you do in a week?
So I will go to the gym. I do strength training 2 to 3 times a week.
Okay. Can you tell me what that looks like exactly?
So yeah, I can actually. I do chest press of 45 pounds, 12 reps, 3 times. I do a leg press of 115 pounds, 3 reps, 12 times each. Lat pull down of 45, 12 times 3. Shoulder press, 30 pounds, and like 12, 12, 9. I've been noticing a bit of, like, I don't know what's going on with me, but sometimes I get fatigued faster. And so I can't really hit the weight.
Okay.
Leg curl, 35.
Okay, hold on. Before you go on, is this self-prescribed or did somebody give you this workout?
I did it myself.
Okay. So leg curl.
35, 12, 12, 12. Bicep curl, 45, 12, 12, 12. Triceps, 85.
What are you doing with tricep? This.
No, it's this machine you sit on and you push it down.
Okay, so it's dips. Yep.
Then leg extension, 35, 12 times 3. Seated row, 50. And then flies, 40, 12, 12. And then I do this abs. I'll do like 30 pounds, and you lay in this machine and you pull them towards you, but my back is flat. Then there's another one, it's a rotary torso where you're kneeling down and then you do like this.
Yep.
So I do that 75 pounds and 15 on each side times 3.
Okay. All right.
And
So
then
this is 2 to 3 times a week, you said, yeah?
yes.
Okay.
And then I'll do, normally I try to do at least like 15 to 20 minutes walking on the treadmill. at about 3.5. And then I'll do rebounding like almost every day,
Okay, for how long?
but 30 minutes.
Okay, so you're definitely getting your 150 minutes, low to moderate intensity cardiovascular. Um,
So I've been trying to do now to burn this fat I have to get into my heart range, like 125.
okay,
But I just started that.
okay. And although we are not dietitians, nutritionists, whatever,
Oh,
I'm gonna ask you a couple basic questions,
okay.
because you can do this. So tell me roughly on a given day what your diet looks like, and be honest. I don't, you eat a chocolate bar every day. Okay, cool.
I drink a smoothie in the morning. It's vegetables and fruit and adaptogens,
Okay,
chia seeds, like mega greens, what's that other stuff? Hemp
okay,
protein powder. Then I have lunch with usually salad and protein.
okay,
And dinner will probably be something like that too. Like I try not to have 2 salads a day, but I have 1 salad every day.
okay,
And I've been really just eating clean, like every once in a while. Like on Wednesday, tomorrow, I'll probably have pizza because I'm going to get my next blood tests again.
yeah,
But I've been eating super duper clean since November, which
okay,
I normally eat clean, but I used to have like heavy cream or half and half in my coffee, but I've cut all that out. And
okay. So,
doing so, my cholesterol has dropped 75 points in a year,
that's awesome.
56 points since November.
Fantastic. So here's your homework. And what I want you to do is figure out how many calories you're eating. So it's a little bit of homework, look at your protein powder, look at, add each of those things up. If you put, an apple, an orange, whatever, each piece of fruit is 80 calories, whatever. Let's
I would
see.
say it's less than, it's probably like 1,200 calories a day. And the only reason I know that is right now I'm working on a holistic nutrition plan
Mhm.
because I cook and I've taken holistic nutrition class. So my thing is right now is to incorporate nutrition and exercise for
Mhm.
people to follow so they can get rid of their inflammatory, responses.
Yep. Yep. I'm
So
trying
I
to do
can
the same thing.
comfortably say we could even go with 1,500, but I will calculate.
Yeah, well, and honestly, that was going to be my guess. So let's say I'm just going to use $1.50. So on average, let's say you weigh 150 calories. You weigh 150 calories. You weigh
I wish,
150 pounds, but just hypothetically.
right,
There is all these different equations, your weight times 24 times 0.9 divided by 2.2, whatever. But generally speaking, if you
Right.
times your weight by 10, that's about how many calories you burn a day, basal metabolic rate. So if you weighed 200
right.
pounds, you burn probably 2,000 calories. Now, the Apple Watch has been awesome for me because I know that roughly my basal metabolic rate's like 1,400 calories, more or less. And obviously this depends on muscle mass. This depends on so many different things. But then I'm like, okay, I go for a walk, I ride the bike, and it shows me how many calories I burn. So, on an average day, if I'm burning 2,500 calories, I know I can eat 2,500 calories and stay the same. If I want to lose a pound a week, I've got to cut back to 2,000 calories a day. And then I've got a 3,500, caloric reduction. Now, the stuff that I'm saying right now, you can talk to your client about. What I can't do is say, Tracy, I want you to start adding turmeric, and I want you to add ginger, and I want you to add blah, 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 because, well, actually I can, because you're not going through treatment anymore. But if you were currently going through treatment, I would not make those recommendations because there can be some interference with the efficacy. Yes.
Oh, right. Could you say though to somebody, and I mean, I guess I'm talking more on a broad range, but
Oh, you have to do your own research, but turmeric is an anti-inflammatory. Ginger is an anti-inflammatory. Or it's
Yeah,
better
what,
to stay away from it.
yes, and so like you have that in your book. There's a section on nutrition and it's all things like that. What I would say, if they are going through hormonal therapy, radiation, or chemotherapy, I would highly recommend a visit with a registered dietitian, because a lot of people can get that covered by insurance. If not, see, here's the problem. I wouldn't say check. I mean, you can say check with your doctor, but doctors don't even know.
Yeah, they don't.
You know what I'm saying? So it's like we're finding a registered dietitian, and it's just like paying for a cancer exercise specialist. You know, people are like, oh, I don't want to pay. You know, even if it's one session, this is what I tell people. If I'm, going to be a trainer or whatever, it's an investment in your, it's like education. It's like school. You don't have to be a prisoner to me. You don't have to work with me forever, but give me a couple sessions so I can educate you about the safest, most effective way that you can be training, and what is that worth to you? What
Right.
can you live without for a month that you can get that peace of mind? How many Starbucks do you have a week? How many blah, blah, you know what I mean? It's like people spend money on things, and this is completely aside from a postural assessment, but the bottom line is people spend what they want to spend. And I'm
Right.
perfectly guilty. I'll go spend $200 on my hair, but I don't want to pay $200 on a massage, because after I get a massage, I can't see it anymore. So we all have our things, but if I had to come up with $200 extra and I had to go gray for a month, then so be it. That's a choice I make, right? So there's everybody, you guys all have to decide what your comfort level is when talking to somebody, and what you're going to recommend, what you're going to suggest as far as how. Yeah, we'd all love to have clients that work with us 3 times a week, but those are few and far between. So sometimes you have to make an argument for what they are investing in, which is not only their health, but their education towards optimal health. So that said, going back to what you were asking, can you talk about turmeric? Yes, generically, absolutely. You can read about, get a book on the anti-cancer diet. There's a gazillion of them out there. And inflammation is a real thing. If you remember day one, I had that arrow: infection, inflammation, chronic irritation equal disease equal cancer. And that's something we all have to deal with at some point or another, and reflecting on what we're eating. So bottom line, check out the calories. I think we're in the right place. And so I don't think it's about caloric restriction for you.
Right.
I think you're doing some fairly, I want to say, heavy weightlifting. And you're probably building a good amount of muscle. How long have you been doing your weight training routine?
For a year now.
So my guess is that you're building muscle underneath fat. So the focus needs to be on, reducing body fat, which doesn't always work in our favor. I think we're going to come up with a little different workout in the end, and you can go back to what you're doing, but I already know some things that are not working in your favor here.
Excellent.
All right.
That's
So
why I
then,
volunteered for this.
good. Yeah. And, hopefully we get some participation on. So Thursday will be the goniometric measurements. I'm going to need you, if you can dress just like you are today, that's great. We're just going to be doing upper body. We need you, preferably if we can lie on the floor or a hard surface, that would be optimal. But I'll also need to do some measurements upright, because I don't have a hovering camera over your body if you're lying down. So if you can have a chair without arms, like a fold-up chair, dining room chair, something like that. And then we'll get on 10 minutes early again and try and just make sure everything is hunky-dory with how the camera's laid out. And then you guys, you won't have it by Thursday, but if you want to get on Amazon, you can order yourself. This is a little one, and see, it loses its ability to hold itself in place. So basically this one is garbage at this point. The little ones are very flimsy, but you can usually buy a 12-inch one, and then this is a 6-inch one. This is perfect when I'm using, I have a little MacBook computer, so it's only like 13 inches. So I can actually hold this right up to the computer to take
Oh,
measurements.
how cool.
Where if I had the 12-inch one, it would be impossible, but the 12-inch one is better for in person. So you can get that on Amazon. It's going to cost 15 to 20 bucks. You might have it by Thursday and you can play along, but if not, it's not a big deal. So any questions, Tracy? You're the only one who's everybody's doing their background stuff. So do you have anything before we go?
No, I don't think so.
Okay, well, thanks a lot for doing this. And like I said, Thursday's part 2. So if you guys were working with someone in person, you'd do this all at once and you'd gather all that information. Then you go home, you look at their health history, you take all this assessment information, and then you put it together in the workout. If you think of anything else with, previous health history stuff, let me know. Sometimes, like the meniscus. Oh yeah, I had a meniscus thing. Sometimes we forget because we have so much stuff going on in our body.
Right. Yeah, I think that's it.
Okay. All right, cool. Well, you guys have an extra 11 minutes of your life. Cindy, the name of the instrument is a goniometer, and you'll see it in module 3. It's gonio, G-O-N-I, meter, M-E-T-E-R. So what we're doing right now is all in module 3. If you guys want to start reviewing that, and then, you'll see everything about postural assessments, goniometric measurements. There's a review of anatomy, physiology, so on and so forth. And then if you have any questions, reach out to me. Otherwise, I will see you at the same time on Thursday. And then next week, we'll actually put this all together into the workout.
All right. Thank you.
Thank you. Bye, you guys.
Bye-bye.